So types of different dysfunction. So those are different kind of reasons we could have dysfunction, but different types of dysfunction. So one person can have stress incontinence for a completely different reason that another person does. So if you look at your pelvic floor, the muscles, the system could be not working properly because the muscles are tight. If you walk around with a tight muscle, it contracted all day, and then you go to ask it to do something, it's going to have nothing left to give, and it's just going to release. So a lot of times people think tight muscles must be strong muscles, but a tight muscle is a weak muscle. So if being able to have a nice healthy resting tone for your pelvic floor muscles, and then being able to have a good full range of motion. So the pelvic floor muscles contract in two different directions. They close and lift and shorten, and that's your Kegel. Then you let go down to your resting tone, and then you can lengthen your pelvic floor muscles from there. So when we urinate, we lengthen our pelvic floor muscles. When we have a bowel movement without straining, we lengthen our pelvic floor muscles. We just don't always know what we're necessarily doing. So we'll work through that, because that can be a good way, if you can use your breath to lengthen your pelvic floor muscles, to reduce tension on your own without having to go any further, but also to reduce stress, to reduce your central nervous system. And then trigger points. So tight pelvic floor muscles often will have trigger or tender points. So being able to identify that and work those out, and then be able to work on the coordination piece. There could be scar tissue, especially from any trauma or for childbirth. Working through scar tissue. Some, I didn't put it there, but like radiated tissue, people who have had radiation, the tissues are going to be different, and they're not going to be as pliable, and being able to work with the tissue in that aspect. And then so tight muscles are weak muscles, but then you can have just weak strength without the tightness. So being able to identify which is which, and come up with a plan to be able to strengthen them. When you're strengthening the pelvic floor muscles, you want to think of like functional strength. So we want to have a quick contraction, because we need something real quick if we have like a sneeze or a cough or something that we want to be able to respond to quickly. But we also want to have like an endurance strength. So we're not going to be able to get to the bathroom right away. So we need to be able to hold it and get to where we need to go. Coordination we talked about. And then there's other different types of pain which can come from tightness, but there can also be nerve involvement as well. And just trying to identify and work through what is it that's causing the symptoms that you're experiencing.